I think there's still certainly a role for test strips or the Clear Blue monitor that gives just simple low high peak for people who have very straightforward menstrual cycles and say they just want to find when ovulation is to identify either whether to get pregnant or to create a window around that to avoid pregnancy. The reality is that those simple systems are easy to interpret, and that's still a good thing. And a lot of people, I think, will be interested in that. Where you're going to see people more interested in the detail are people who are trying to get pregnant, say they have polycystic ovarian syndrome, and we're going to be treating that, and we want to follow to make sure that this the hormone changes reflect what we're doing as far as treatment goes.
Hello and welcome. My name is Grace Emily Stark, and I'm the editor of Natural Womanhood. I'm here today with Dr. Thomas Bouchard. He is a general family practice doctor who practices out of Canada, Calgary, Alberta, to be exact. We have him here with us today because Dr. Bouchard is doing some very interesting research that's pertinent to our work here at Natural Womanhood and of interest to our followers and our listeners and our readers. He's picked up a new, what would you call it? A new initiative lately, in that he is also pursuing a PhD, because I guess an MD isn't enough for some people. But he's doing a PhD program in menstrual cycle monitoring. And he's published some interesting papers in that regard lately that caught our attention here at Natural Womanhood, specifically in regards to hormone monitoring. We know a lot of our followers are really interested in some of the fertility awareness methods that use hormone monitors, such as the Marquette method, that uses the Clear Blue fertility monitor, but that's not the only monitor on the scene anymore. And there are different ways of monitoring hormones and different hormones that are monitored. So we're here today to talk to Dr. Bouchard about all of the nuances of hormone monitoring, what he's been studying, and we're really grateful for him being here today. So without further ado, Dr. Bouchard, would you please introduce yourself for our audience?
Sure. Yeah, so I've been a family doctor for over 10 years now in Calgary, and I do general family practice. I delivered about 500 babies until during COVID, I had to give that up because my nursing home got quite busy during COVID. So I had to focus more attention there. And I still work at a nursing home a few days a week. And then, but in order to pursue this PhD this past year, which is going to be part-time, I did reduce my workload at the nursing home so I can do that. So I'm juggling a few different hats with general family practice, where I do a lot of fertility consults, and then the nursing home, and then the PhD as well. So that's it in a nutshell right now.
Well, that's really full spectrum family practice, huh? You're talking about beginning of life and end of life. That's really fascinating. I had a family practice doctor actually do all my prenatal care and deliver my first baby. And prior to that, I didn't even realize that family practice doctors could do all of that. But once upon a time, that was kind of more the norm, to take care of families, right? And families are the very young to the very old. So I think that's wonderful that you have taken that approach in your own practice. So what then, as a medical provider, has gotten you interested in fertility awareness methods, and where did that push to dive in and do a whole PhD program really about it come from for you?
Yeah, the first time, I mean, this goes way back because my parents were teachers of the Serena method, the Canadian version of symptothermal. And so I knew it even from a young age that this was something that was important for couples, and knew that was something that would be important for me to help with and support as a family doctor. When I was a medical student, I did some research with actually a gynecologist in Edmonton, another city in Alberta, and he was using the Clear Blue monitor on its own without the Marquette method. In fact, he was unaware of the Marquette method. So he developed a method of fertility awareness using the Clear Blue monitor in parallel with the nurses at Marquette. So he and I wrote a few papers about the Clear Blue monitor for fertility awareness about 15 years ago. And in doing that research, I encountered the work of the Marquette University nurses and the Marquette method. So I attended a conference with them, and Richard Faring and Mary Schneider were very gracious in letting me join them and help them out. So when I became a family doctor, I did the training for the Marquette method, and we have continued working on research for the Marquette method together since that time, about 10 to 12 years ago.
Great. So moving into that, Dr. Faring is obviously kind of one of the big heavyweights behind the Marquette method,
Yeah.
and he's still teaching and practicing at Marquette University. What's his clinical background again?
He's
Could
a
you remind me
nurse,
about
a
that?
PhD nurse,
That's right.
and
Yes.
so is Mary Schneider. And what's really interesting about the background of the folks at Marquette is they are very focused on research, and that's
Yeah.
attractive to me. And so when Mary Schneider recently finished her PhD, I was thinking, hey, this sounds like fun. Why don't I try that too?
Nice. So in 2021, you actually co-published a paper with Dr. Faring. That's kind of going to be the touchstone for our interview here today. It was a paper about qualitative versus quantitative estrogen and luteinizing hormone, or what we would call LH testing for personal fertility monitoring. So we're going to kind of break down a few of those different terms that some folks might not be familiar with just in the title of that article. So one of them would be, qualitative versus quantitative hormone monitoring. That's not something I think a lot of people would be necessarily familiar with. They just get a hormone monitor like the Clear Blue or the Myra, which is the one I think you've been studying, and we'll talk more about that later. And just know that they, dip a pee stick into it and aren't necessarily aware of how it's monitoring their hormones or even what it's monitoring. So can you give us, I guess, first, let's delve into those monitors. I think that would be a good place to start. What are some of the familiar examples of fertility monitors out there? What are they exactly? What do they monitor? And how do they do what they do?
So starting at the very basic, you'll get LH test strips, which are line-based tests, and they will tell you whether you have an elevation in LH. So there's lots of ovulation test strips that you can get on Amazon or at pharmacies that are quite cheap, but they have very basic information. Basically, it's a user looking at the intensity of the line to decide whether that's a positive or a negative. But there is some subjectivity to that. Then you get to the Clear Blue monitor, and when we refer to qualitative, it would be this line-based test strip or the Clear Blue monitor's results, which give low, high, and peak. The high is when estrogen starts to go up, and the peak is when LH surges right before ovulation. So that is qualitative because there's no numbers involved. Whereas the new Mira monitor is quantitative. And there's a few other monitors out there that are also giving quantitative numbers. The UVA monitor, the Prove system, which looks at a bunch of test strips that you take a picture with on your camera, and the Anido monitor, all of these give actual numbers of hormones. So when you get numbers of hormones, that's when we call it quantitative, because you're actually able to follow through your cycle on a daily basis the changes, the dynamic changes in estrogen, LH, progesterone, and now even follicle stimulating hormone or FSH. So what we're able to do now with quantitative monitors is see in exquisite detail what's changing in a menstrual cycle and identify maybe some abnormalities there too, in addition to using it for fertility reasons.
So you're getting much more granular, it sounds like,
That's right.
than with the qualitative monitors where you're just kind of looking at the lines or getting the low or high reading.
Yeah.
That's really interesting. Which FAM protocols, fertility awareness method protocols, utilize these monitors besides the Marquette? Are there any others out there?
I think there are a few people who are interested and who are watching what happens in the industry as far as which of these monitors are going to be most useful for them. I think the reality is that regardless of whether a fertility awareness method is interested in these monitors, users are interested. So
Yeah.
what we're seeing with the Marquette method and people who have used Marquette for a while is that users are kind of advancing with technology even faster than we can keep up with the research. So users are going to want to use these new technologies to integrate them with apps and are going to start leaving behind some more traditional markers because we're getting these higher tech, very detailed ways of analyzing the menstrual cycle. And let's face it, the new generation of folks using FAMs are very interested in technology. And so we want to keep up with that.
Yeah, I did just see the other day one that you actually put in your toilet,
Right. Yeah,
um,
I saw that
that
too.
monitors. It's so funny because I remember doing a podcast episode with my co-host, Cassie, and one of our early episodes, and she made a comment about, I can't, I'm waiting for the toilet someday that I can just pee into and it gives me a readout. And so I saw
There it
this new
was.
monitor that you clip into your toilet and I went, oh my goodness. We were talking about that just a couple of years ago,
Yeah.
what an innovation that would be. And it's basically here now. And I think you're right that it really is driven by the consumer who wants that ease of use. I do wonder though, with the quantitative versus the qualitative, um, are there, in the women who have used them, is it too much information to be following all of these numbers? Are there some women who would just prefer the low, high, peak type readouts that you get from the classic clear blue? Or are there a lot of women who are really hungry for kind of the more granular numbers, or is it more for use by their physicians in diagnosing, fertility issues, cycle issues? Who's more interested in that data, do you think?
Yeah, that's a very good question. I'm glad you asked that because the more information that you gather, the more complex the system becomes. So there is
Mm-hmm.
something really important about trying to conserve an element of simplicity in looking at these new technologies. So to give you an
Mm-hmm.
example, Mira has tried to create a system, a score of 1 to 10 to classify the numbers that are obtained as far as what is your fertility score, 1 being low fertility, 10 being peak fertility. So
Mm-hmm.
regardless of what information you gather, the more complex the information, the more you have to work to simplify or overlay some system over top of that to make it user friendly. So
Mm-hmm.
I think there's still certainly a role for test strips or the clear blue monitor that gives just simple low, high peak for people who have very straightforward menstrual cycles and say they
Mm-hmm.
just want to find when ovulation is to identify either whether to get pregnant or to uh, create a window around that to avoid pregnancy. The reality is that those simple systems are easy to interpret, and that's still a good thing. And a lot of people, I think, will be interested in that. Where you're going to see people more interested in the detail are people who are trying to get pregnant, say they have polycystic ovarian syndrome, and we're going to
Mm-hmm.
be treating that, and we want to follow to make sure that the hormone changes reflect what we're doing as far as treatment goes. And then a big category in the Marquette method is our postpartum protocol. So a lot of people
Mm-hmm.
come to Marquette when they're breastfeeding and postpartum,
Yep.
and the Clear Blue monitor does have some disadvantages because you have to keep resetting the monitor because it expects you to be in a
Mm-hmm.
regular cycle. Whereas the Mira
Mm-hmm.
monitor and the other quantitative monitors don't require that. You can test any day, and because the convenience of testing any day, you don't have to reset anything. You'll be able to track on a daily basis without having to do these reset protocols. So I think the postpartum protocol will be really helped by these quantitative monitors. A few other areas that we're looking at besides the PCOS, which I mentioned earlier, is the
Mm-hmm.
perimenopause. So the perimenopause is a special time when there are going to be changes in the cycle, and we'd like to find out, are these truly fertile cycles or not? So we're working on a case series on that right now. And then another opportunity to look at things would be for people on certain medications that might affect fertility. So we have a case series looking at women on chemotherapy. And I did an interview with uh, Natural Womanhood last
Mm-hmm.
year. And this was
Yeah.
found by some people in Europe who contacted me wanting to help
Oh,
to
wow.
track their cycles
Great.
during chemotherapy. So this is brand new, and this can only be done with the quantitative monitors.
And they contacted you because they had found our article that
Yeah,
we did with you?
yeah,
Oh, that's so wonderful. Wow, I'm so glad that connection was able
yeah, it
to
was
be
cool.
made because of that. Wow. So I think what it sounds like to me, the real advantage of these newer monitors, especially compared to the Clear Blue, is that the Clear Blue was never created with the intention of cycle tracking, right? It was for women trying to get pregnant and trying to figure out if they got pregnant,
Yeah,
um, and wasn't necessarily for cycle monitoring. But the clever folks at Marquette, obviously developed the protocols around it, and it's worked really well, like you've mentioned, especially for postpartum women, even with some of the difficulties and the nuances of trying to kind of make this technology fit
yeah,
what they're using it for. But some of these newer monitors were actually developed with tracking the cycle in mind. So yeah, a lot more user friendliness there, I would imagine, because of that. Um, so in particular, in the papers that you've published in studying these monitors, the focus is on the luteal phase, right? So can you just give us some background on why women would be concerned, in particular, with monitoring their luteal phase, and what doing so tells them about their health and fertility?
yeah. That's a good question. The luteal phase is based on the change of the dominant follicle that it gets ovulated. That follicle turns into what's called the corpus luteum in the ovary and produces progesterone. So the luteal phase is really marked by progesterone type changes. And what we can do now with these quantitative monitors is evaluate progesterone, which means we can confirm that ovulation has happened. And we can also evaluate whether the progesterone changes during the luteal phase are adequate to sustain a pregnancy. So that if people are trying to achieve pregnancy, we can actually say, is their progesterone adequate? Sometimes, if you have lower progesterone, you're going to have a shorter luteal phase, and that makes it hard to get pregnant. And so in the literature, there's something called luteal phase deficiency, which a lot of FAM researchers have looked into over the last few decades. And
Hmm.
it's a little bit elusive because a lot of people in the medical literature who are not familiar with FAMs but are just doing things for infertility reasons have
Hmm.
questioned whether there's actually a thing related called the luteal phase deficiency. And now with these
Hmm.
quantitative monitors, we'll be able to define that. We'll be able to say, is that progesterone lower? Does it shorten the luteal phase? And if so, can we change the chance of conceiving and maintaining a pregnancy if we supplement with progesterone during the luteal phase? And using these quantitative monitors, we've already seen that when people take supplemental progesterone to support the luteal phase, that can be shown on the monitor where it's definitely maxed out. You give supplemental progesterone, and when you monitor that progesterone on these fertility monitors, that level is maxed out, and you can see that they're obviously sustaining a higher level of progesterone.
That's really fascinating, particularly to me, because several years ago, I had a doctor who diagnosed me, a restorative reproductive medical doctor, who diagnosed me with luteal phase deficiency. And he did supplement me with progesterone. Um, and what was really fascinating was he was practicing in actually at the Naval Hospital on Guam,
Oh wow!
because that's where we were living at the time. My husband was in the Navy for a while, and he did the progesterone supplementation after determining via looking at my charts and some blood work that he thought I had a luteal phase deficiency. And it was incredible to see just in my paper charts. We weren't using any kind of monitoring. Again, this was several years ago, so I don't think any of these monitors actually even existed at that point. But you could see in my paper charts the difference in my cycles as I continued with the progesterone supplementation. 2-3 cycles onwards, my luteal phase was lengthening, my basal body temperature was improving post ovulation. This was with the symptothermal method. Um, and he actually asked me if he could, copy my charts, photocopy my charts, and take away the personal identifying data and show them to his colleagues at the Naval Hospital, because a lot of them were very suspicious of what he was doing. that it was helpful. Some other patients at the hospital were wanting to do it, and there was some pushback. And so I can imagine having not only the paper charts that show that very clear change in the health of a cycle, along with quantitative data for those, science-minded folks who really just want the hard numbers. Having those two paired together really would provide kind of that compelling picture that we need to show people, yes, this is a thing.
Mm-hmm.
Luteal phase deficiencies are a thing, and there is a way to help correct them. So that's really fascinating to me,
Yeah.
that there's that potential to use these that way. So I want to move next into how, we've talked about these monitors in the context of someone trying to get pregnant, or someone who's postpartum, or breastfeeding. But what about women who, just a normal young woman who isn't trying to get pregnant, who isn't married? Do they have something to gain by using these monitors? Is there an alignment there just with good women's health, regardless of your fertility goals, in using these monitors?
Yeah, I think there is. I think in these cases, the use of a quantitative fertility monitor may be less intensive. So rather than daily testing, you might get somebody who does every second or third day testing. Or maybe,
Mm-hmm.
a woman wants to have these detailed hormone levels around the time of ovulation to confirm ovulation. So maybe she tests 1 or 2 times a month. Another possibility is a woman who wants to use the progesterone test after she sees peak in mucus, right? So there's all
Mm-hmm.
kinds of different ways that these can be used, and by no means do they have to be used in kind of a very stereotypic way where everybody has to test on every day on a daily basis, which can get quite expensive. But I think there's
Yeah.
lots of ways to adapt this to say maybe every second day testing, maybe around peak, and doing some post-peak progesterone testing could be very helpful. Women with irregular cycles would really benefit from getting a better understanding of their hormone profiles so they can
Mm-hmm.
distinguish what's happening, and maybe bring that to a family physician or a gynecologist who can help interpret that data and give them some advice and maybe some treatment, whether it's
Mm-hmm.
PCOS or something else. But this also requires that physicians are familiar with the technology, and not a lot are. So hopefully with the research, we can get this information out so people can see, how do I interpret this information? What is the medical
Mm-hmm.
literature saying? So that physicians out there are able to take these monitors and trust what data is being provided, because there is research behind it. So I think a lot of people
Yeah.
will benefit, but I don't think that everybody is going to be using them in the same way. I think some people will use it for a post-peak confirmation because maybe their ovulation is not always clear. Some people will
Mm-hmm.
use to identify whether their estrogen is unopposed, like in polycystic ovarian syndrome. People on, say, certain medications like a chemotherapeutic agent, or maybe who have thyroid issues, might want to see what changes in their hormones are happening. And some people may move in and out of using a quantitative monitor. They may find for a time, maybe the postpartum period, they want to use it. And then once they get back into regular cycles and have very predictable changes, maybe they don't use it as much or at all.
Mm-hmm. And yeah, because I know I actually use and teach the symptothermal method with the couple to couple league
Yeah.
here in the United States. And what I really appreciated about what they have done is they've recognized that a lot of folks do want more of that objective picture postpartum, because it can be such a complicated time for charting. And they've actually cross-trained some of their people to also offer the Marquette method, which I don't know how it is in Canada, but here in the United States, for a really long time, the different methods did not play well in the sandbox together,
Mm-hmm.
which was very unfortunate. And Natural Woman, I like to think Natural Womanhood has done a really good job in kind of bringing folks together and saying, look, we all have something to offer.
Yeah.
And that's been a big part of our mission here at Natural Womanhood, is to present all of the different methods, kind of what their pros and cons are for different phases, different different goals in fertility, and just say, look, there's no one better method. Different women will use different things at different times, and that's okay. And again, the couple to couple league has recognized that, the Marquette method is desirable to a lot of people in those transitional seasons, like when you're breastfeeding, postpartum, and perimenopause, as you mentioned earlier. But so the fact is that a lot of people, women are not aware of or are not particularly interested in doing this really deep dive into their fertility, or it doesn't seem relevant to them, I guess, until they are trying to get pregnant. That is when a lot of women start to do a deep dive, especially if it's taking them, a few cycles. Well, what can I do to figure out when I can get pregnant, or to prepare my body better for pregnancy? And that's when, I've heard a lot of women say, wow, that's when I really started learning about my body and my cycle, and I got a monitor, and, their eyes are kind of opened. So I think the next question is these different monitors, and in developing these different monitors, is there a goal with different monitors to be more geared towards trying to conceive, or are they trying to kind of give women the full picture wherever they are in their fertility that they can monitor? I guess what I'm trying to ask is there a better approach for trying to conceive versus everything else? Would you be better served by a quantitative versus a qualitative monitor, depending on whether you're trying to get pregnant or not? Or is it just so dependent from woman to woman?
Yeah, when I propose menstrual cycle monitoring to people trying to conceive, I will give them the option, and I will assess whether they feel like they want more detail or not. I think a woman with polycystic ovarian syndrome would benefit from quantitative monitoring to get more detail. There are some women who may not get a peak on the Clear Blue monitor, but might have a lower threshold LH surge that will be picked up on the mirror monitor. So I think, although there is kind of a lot of options available for people, we do need to steward them to kind of give them the best advice possible. So right now, even though most of my research is focused on the mirror monitor, I know Prove has just published a paper on their system, and Anido has published a paper on their system as well. So I would say giving people the option of choosing which monitor they want to go with. At the end of the day, you want to go with something that has a lot of data to back it up, that has research looking at different aspects of achieving versus avoiding pregnancy. I don't think these new monitors are targeting achieving only, which is what the Clear Blue monitor was marketed for. I think they're actually being marketed to achieve and to monitor the menstrual cycle. It's an interesting question to say, can it be used to avoid pregnancy? Because FDA has very specific criteria for marketing something as a contraceptive device. So I think it's fair and actually totally fine for these monitors not to consider marketing it for contraception, because that's a much larger hurdle to cross. And Clear Blue had a separate monitor called the Persona monitor that was studied in the US about 20 years ago, and it didn't fly because of some of the data that they were going to analyze. And so that monitor never came to market in the US because the trial looking at the contraceptive intention of the monitor didn't work very well. Not that the monitor didn't work, it was just that the study and trying to get FDA clearance was not very straightforward. So I think marketing these devices for achieving pregnancy and then allowing them also to be used for menstrual cycle monitoring, and say a FAM method like the Marquette method, incorporating this with certain protocols, that's what allows couples to really use it for avoiding pregnancy when they'd like. So I think there's no specific, now there's no specific target audience of only achieving pregnancy. We can now use these monitors for all kinds of different purposes, and they're becoming much more versatile, in addition to adding on apps and that sync with these monitors as well.
Yeah, and I get ads on Instagram all the time for different monitors that they're targeting very specific populations of women now. They're getting pretty nuanced with it, where I see specifically ads for women who are trying to conceive with PCOS.
Mm-hmm.
That seems to be a target market for a lot of these different monitors, which is interesting to me. And I wonder, is there any data behind any one of these monitors being more successful at helping women specifically with cycle issues like PCOS to conceive than others? Or is all that data still just kind of being gathered
It's
currently?
still being gathered. So one of the aims of my PhD research is looking at couples with PCO, like a woman with PCOS. We're also going to
Mm-hmm.
be following women with endometriosis as well, pre and post surgery. So this is
Oh, great.
all very new. So there isn't any published research on any of the monitors looking at PCOS. So because it's new and emerging, people are going to look for this information. So that's why we're trying to catch up with the research, which takes time and planning, but people want that
Mm-hmm.
information.
So I guess that's where are they using the data from these monitors? Are they collecting people's data? Because there's some security questions there that often come up with how much of this data are they collecting, and it's pretty personal data. Um, I think Natural Cycles might be collecting data. I don't know if I'm correct on that, but anything that's connected to an app, right? There's the potential for that, and a lot of folks don't go through and necessarily read the fine print when they download an app that's paired to a monitor or not. But what are your thoughts on that, on data being collected, and the good and the bad
Yeah,
that can
that's
do?
a very important question because security and privacy are going to become even more important as big data is being used for purposes that people may not be aware of. And I
Hmm.
think a lot of companies are aware that people don't read the fine print. And
Yeah.
that when it comes to menstrual cycle monitoring needs to be emphasized to couples. And one of the ways that this can be done is to look at menstrual cycle apps. And there's over 1,000 apps for the menstrual cycle on the market.
Hmm.
And a lot of them have had data breaches. So
Hmm.
I know Couple to Couple League is coming out with a new app, and they
Hmm.
certainly are looking at privacy there. The app that I'm going to be using for my PhD research is from a not-for-profit in the UK. It's called Read Your Body, and the thing that Read Your Body does well is there is no cloud involvement. So the data is only
Okay.
on your device, and it
Hmm.
can't be seen by the company, Read Your Body, or by anybody else for that matter, because it's only stored on your device. So I would highly recommend an app that is not tied to a cloud-based service so that your data is
Okay.
stored locally. What we're going to be doing when we collect data through this app is we're going to be exporting data directly to a research database in an anonymized way. So when people
Hmm.
push data to our research database, it's anonymized as it's being pushed. So we don't have any identifying information when they push their data to us. But for the end user, their menstrual cycle data can't be used unless they push it to the research group. If they don't push it, it's only contained on their phone. This is different
Okay.
from most data collection for menstrual cycle apps, which is in the cloud. And most people just
Mhm.
assume that that convenience factor is just part and parcel with using a menstrual cycle app. But I would suggest that people pay more attention to these privacy issues because menstrual cycle
Mhm.
data is very personal, very private, and I think it
Yeah.
deserves a lot of protection in the digital age. So I think local storage of menstrual cycle data is the most important. And if people participate in research to do things in a way that's very private and secure, like we're doing, where they have to voluntarily push data to us to use it, and in the process of pushing it becomes anonymized. And there's an interesting organization that Read Your Body has kind of pointed to that I think is very useful. It's called the Center for Humane Technology. And they really emphasize the importance of being attentive to technology use and not just being a passive user where
Yeah.
data security and privacy can be taken for granted by big companies and big data.
Yeah, that's really interesting and really important. And I do imagine that there are a lot of women who would want to help the research, especially because this is such a burgeoning field, and any woman who's ever suffered any kind of infertility, um, you know, it's not something you'd wish on your worst enemy.
Mm-hmm.
I've been there. It's terrible. And if you, as a woman, could say, my data, if it's anonymized, can possibly further the research so that more women and couples don't ever have to go through this. I imagine that if there's a safe way to do that and an anonymous way to do that, that a lot of women would say yes, absolutely.
Yeah.
But the issue, I guess, with a lot of these apps and the monitors paired to them is that they're just not asked, right?
Mm-hmm.
They kind of sort of are because it's in the fine print that they agree to, but is that really informed consent?
Mm-hmm.
That's a topic for another day.
Yeah.
But I think it's really great that there are some folks out there that are paying attention to how sensitive this data is and giving women real choice about what they do and do not share.
Yeah.
With their data. That's great. So on another note, you kind of touched on this, the expense of these methods. Marquette, I know, can be very cost prohibitive for a lot of folks because that monitor is so expensive. And you have to keep, it's a continual expense to purchase test strips. I have heard in the United States, I know you're in Canada with universal healthcare, but I have heard in the United States that some folks have had luck with maybe getting HSAs, health savings accounts to cover some of these costs. But on the whole, it's difficult to figure out how to get any kind of FAM coverage actually covered
Mm-hmm.
here in the United States. And it can represent a big out-of-pocket cost, especially if you're going with one of the more tech-heavy fertility awareness methods. So I wonder what maybe you can speak to are there the same issues in Canada? Are these devices recognized as medical devices and therefore covered under your national insurance scheme?
Good.
Or do your patients also struggle with it there?
Yeah, it's not covered. And in general, in most jurisdictions, medical devices are not covered. I think diabetic supplies are the exception. So these are things that we can do to advocate with policymakers to try to encourage them. Like a diabetic would get supplies covered. I think FAM
Right.
supplies should be covered as well through insurers. Right now, the best option is the health spending account. So if people have benefits where they have a health spending account, I would encourage them to ask their doctor for a note that indicates, the Mira monitor with test strips for 1 year, or Clear Blue monitor with test strips for 1 year, or whatever they're using, so that they can submit that to their benefits. As long as it's prescribed by a physician, they should be able to get it on a health spending account. And that's what I do for all of my patients. But in general, we should encourage policymakers to help with these costs if possible, and make the argument that analogously to how diabetics use their devices and can get those things covered under a regular health benefit rather than a health spending account. So we should advocate for these things. I think cost should not be prohibitive. I think we should be able to help people. Maybe they can get a device from a friend, or they could, maybe use it temporarily. Maybe clinics could offer some monitors temporarily to people. The test sticks, I think if we have protocols that don't use everyday testing, could be made cheaper. So I think there's lots of ways to get around what seems like cost prohibitive nature of these monitors in the first place. But in general, when you look at what people spend on other things, I think it's just a matter of budgeting in and seeing, well, how many test sticks can I afford? How can I spread them throughout a month, right? The monitors last for several years. So the initial cost of, say, just over $200, if it were covered by a health spending account, would be great. If not, I think a lot of people are willing to pay that cost because they see the tremendous benefit from these devices.
Yeah, it's really in the United States, it's actually really, I think, more analogous to breast pumps, because diabetics, there's the pushback that can be made that's like life-saving care for them. Fertility awareness monitoring, not quite the same thing, although obviously it can be a very powerful diagnostic tool for serious issues that really affect one's quality of life, from PCOS to infertility. But I think there's an analogy there for breast pump coverage, and more recent years, more insurers have covered breast pumps.
Mm-hmm.
But there still are, ongoing costs to the user. You purchase the storage bags, you might need to purchase additional tubes
Yeah.
to connect the pumps and whatnot. And there has been success, obviously, here in getting coverage for those devices. So,
Yeah, that's another good analogy for coverage.
yeah, I do think that there's some hope there, but yeah, we definitely need to be advocating for that, and in doing so, showing all of the different ways that these monitors are used that we've talked about today. I think in kind of closing our interview today, I kind of want to know what you see as the future of all of this. So, the future of fertility monitoring, along with fertility awareness methods. Are we going to be testing blood at home? Is there promise there that might be better and above what we get from testing urine? Or are we going to get even more granular and precise with the hormone numbers? Where do you think this technology is moving us
Mm-hmm.
in the future?
Yeah, that's a good question. I think blood has been something that my colleagues have been interested in for a while. I've been less interested in blood because a finger prick test, like for a blood sugar in a diabetic, like we've been talking about,
Mm-hmm.
um, is somewhat more invasive, both in a
Mm-hmm.
patient's mind and technically more difficult than collecting urine and dipping a urine test stick, right? So
Mm-hmm.
that increased invasiveness is a bit of a barrier for some people to think about that. But there is
Sure.
also a technical reason why I don't think it's as useful as urine. Serum or blood is a snapshot in time of what's happening in the moment with hormones, whereas urine through the kidneys, which are a concentrating organ, is more reflective of what's happening over several hours. So because urine concentrates and gives us a measure over a day or whenever you're testing in the day, we're using that to give us an average view of hormones over a time period rather than a snapshot in time, which is what is given in the blood. So I think urine will remain probably the most useful tool because it's less invasive and it reflects hormones over time. I think, we talked earlier about that device that measures hormones in the toilet, but that's
Mm-hmm.
going to be certainly more expensive because you're doing way more testing on a regular basis. So I think
Sure.
as technology advances, the biggest things are going to be cost benefit versus level of detail, and how do we bring that level of detail to a level that's interpretable and easy to act on by the end user. And I think, to me, the future is integrating these complex details, or the extra granular information we're getting from the mirror monitor and others, into an app, into something that is incorporated in the day and is something that can give you really good advice. And like we said earlier, these apps need to be secure and private. So I think the future is, being able to use these technologies in a secure and private way, get the information, make sure it's reliable information, and be able to interpret it at home, or maybe with the help, if there's abnormalities, with the help of a doctor.
Mm-hmm. Wow, it's really interesting. I've never heard anyone explain the difference between hormone the urine and blood question that clearly, because I've had both over the course of my just infertility treatment and giving birth and postpartum and whatever. And I've never really understood exactly why some providers want to do blood, some want to do urine, and what the different data you can gather from them is. So that's really interesting. Before we go, my final question for you is: in all of this research that you're doing, what is giving you the most hope for the future of women's health?
I think that the hope is the fact that women are the ones who can take control, and they're the ones who have the information. They're not dependent on asking for a blood test or asking for a way to investigate their health. They can do a lot of this at home and get a lot of tools online. You got to be careful
Mm-hmm.
about what tools you use, but a lot of this is now in the hands of women and couples to be able to really take charge of their fertility, to steal the title of a book. The whole idea behind home-based testing to me is that women are the ones who are in control, and they're advocating for themselves. They're using physicians and nurses as support people in their fertility journeys, or just to monitor their menstrual cycle for health reasons, right? And so this to me gives a lot of information and tools to women to really act on themselves, and to really see their cycle as something that is incredibly intricate and beautiful, and something that gives them a lot of signs about their own health. So I think the hope is the fact that women themselves are now being empowered to have more information to use to take care of themselves.
And that's awesome, right? That's what we want. That's certainly our goal at Natural Womanhood. Dr. Thomas Bouchard, thank you so much for being here with us today. I want to give you the opportunity to tell anyone listening where they can follow your work, if they're interested in collaborating with you. How can they reach you and follow what you're doing?
Yeah, if they want to go to my website that I'm using for the PhD work and other research, it's called quantumfertility.com. And they can send me a message at thomasbouchard@quantumfertility.com. And just a plug, if people want to donate to NFP research or FAM research, there will be a link on that page that they can use to contribute, because we need lots of people to throw resources behind this research, because we don't have big pharma dollars for this. We need people on the ground to really support us.
Awesome. Well, thank you so much for being with us today. Thank you to everyone who is listening in. At Natural Womanhood, we are so excited to feature the voices and the work of folks like Dr. Bouchard, who are doing really great work in the field of women's health. Thanks.
Thank you. And thanks to Natural Womanhood. I'm a big fan of your work.
Thanks.